I'm sure you've had a chance to have a look at what Keir Starmer is suggesting: reducing deaths by suicide within 5 years, reducing deaths from heart disease and stroke by a quarter within 10 years, and hitting all NHS cancer targets. That's quite a list.
Yeah, it's certainly ambitious. It sounds like Starmer's Labour Party is quite serious about trying to create a country where everyone has a chance to grow old in good health. I think we should all welcome that. The big question is, can they do it? The last time we had a Labour government, they did transform the NHS. But the challenge this time, it's harder. The starting point is worse. And where they're trying to get to is a higher peak, is a harder climb. Not only are they saying we're going to bring down waiting times across the health service, they're saying, actually, we're going to improve survival rates and we're going to increase life expectancy. That's a really tall order. It's going to need investment, but I don't think anyone thinks we're going to see the same kind of investment that we saw under New Labour, that 6% a year. So that means the Labour Party, if it does form a government, will have to go much further, much faster on finding the right reforms, both within the health service and outside of it, if they're going to deliver on those missions.
Where does the money need to be invested? Because, of course, everybody would put their hands up to say, yeah, we want a better NHS. Of course we do. But, you know, it literally is a pot of money, and whatever money you put into it, you always need more.
Well, we need smarter use of our money, right? We do need these reforms, so there's no point rewiring the circuit if you're not going to put new batteries in. And while funding is a pretty critical determinant of how good our public services are, but it isn't the only one. So what Labour are saying is that what we need to do is try and shift how we spend our money within the health system. So we're not just waiting for illness, but we're creating health. That means putting more money into primary care and into community care so we can try and stop people becoming very unwell. I think that's the right idea. Whether we see that happen or not is a big question, but prevention really is a really important step to try and bend that cost curve down. Healthcare costs will go up, but how quickly they go up, that's within our control, and that depends on the policy choices we make.